Good afternoon. My name is Quentin Schroeter and I'm with NAMI Montana. Let's say you have experienced a dire and devastating psychotic episode. That is, a definite break from consensual reality, which I tried to describe in detail in our last session together. And you have been placed in a clinic or a private or state hospital. At this time you are floundering and searching against hope to find any solid, dependable help you can possibly grasp. Your first encounter with a psychiatrist will probably be a doctor who is on the staff or clinic or hospital. At first you will probably be resistant to his or her suggestions because you do not know whether or not you can trust him or her. After all, part of you is able to sense that he or she has your future or destiny in his hands, and what an awesome responsibility that could be. Something tells you to go slowly. Of course, that slow pace is forced on you because initially he sees you only for 20 minutes, which is hardly enough to even break the ice with what you want to communicate with him, let alone arrive collaboratively with an initial diagnosis. So, you're kind of left alone to struggle in utter confusion and with the earth below your feet dissolving. If you are depressive, for example, you would be more than likely sink further into the muck and mire of mental illness. If you are fortunate enough to be started on prescribed medication, doubtless you will have to wait for it to kick in. If you are schizoid, for instance, you will be required to wait for your apparent delusions or hallucinations to completely subside. If you are manic, you will have to wait for the meds to act in order for you to crash and come to your senses. All of this waiting could be akin to Samuel Beckett's play, Waiting for Godot. And what a miserable wait it is. A couple of weeks after your initial beginning of medication, your doctor, hopefully the same doctor, will see you again and observe and scrutinize your behavior and judge whether your medication is working. And if he's highly skilled, he will ask you how you are feeling and how you feel about the entire ordeal you have experienced. Simultaneously, you have to decide if you think intuitively, is it okay to talk with candor with this stranger, and whether you feel comfortable and at ease in doing so. Finally, after a few or more sessions like this one, and the medications do seem to be working to your benefit, you may be stabilized and legitimately released from the hospital. It is then that the road to recovery begins, and you have to reconcile yourself that it's a fact, Jack, that you are in this journey definitely for the long haul. As an outpatient, it is imperative that you decide to go the distance to find a decent psychiatrist. And in the vast rural state like Montana, that is no small order. By decent, may I suggest that a psychiatrist ought to be schooled thoroughly with the structures and biochemical interactions within the physiology of the brain itself. This academic preparation is the predominant MO currently in vogue with the most qualified psychiatrists. If you are alert to a psychiatrist's orientation, you can kind of surmise where he or she is coming from. And for example, if he or she is not condescending and explains briefly what is happening in your brain when you experience your particular psychosis, then you know you're on the right track, and you can be rest assured that you, more than likely, made the right choice in doctors. However, if the doctor exudes arrogance, and during the first session states categorically that he will be the best psychiatrist you ever had, head for the exit, because that is nonsense. That kind of evaluation is completely personal and up to the patient alone. Otherwise, give your doctor an opportunity, a chance. Be honest with him and see if he is easy to talk with and expresses empathetic compassion and understanding. Then you will know decisively whether or not you want to continue with him. Especially, do you want to feel free to discuss why you are being labeled with his designated diagnosis? Are his prescribed meds after a suitable trial run working effectively? Meds should not work against you, but they should clarify your thinking, make you feel better, and most importantly, if possible, motivate you as a worker, student, or whatever you are doing in the world as a highly functioning person. If your meds are not doing at least these three things, it is time for you and your doctor to experiment or adjust different dosages, or simply change your meds. If your doctor is well-grounded in his expertise and knowledgeable in his field, he will not be insecure in his willingness to pursue a variety of evidence-based meds until you and he find the right medicine that is congruent with your metabolism and persona, and you can feel that you are improving. Remember, no matter what the reputation or the hype of a medicine has, if it does not work for you therapeutically, then drop it and agree to try something else. This does require a great deal of you. Courage, flexibility, and patience, all of which are an intrinsic part of the road to wellness. Again, I thank you for listening.